Good afternoon, everyone. Thank you for joining this webinar on part of our continuing Decoding Data and Digital Health webinar series. And this one is looking at health and care workforce optimization through the use of digitalization. And we have some very, very esteemed speakers here, and the webinar will be led by one of our very own from WHO Regional Office for Europe, Crispin Scooter, who I will introduce in a moment. Chris is our technical officer in the health and care workforce, and he is going to be moderating and leading this session, and he will do the introductions and take over from here. So thank you all very much for attending. Without further ado, Chris, the floor is yours. Thank you.
Welcome all. My name is Chris Scotter. I am the Human Resources for Health Policy Advisor in the regional office in Europe, based here in Copenhagen. And I'm leading today or moderating the session with some very, very experienced luminaries, shall we say, looking at health and care workforce optimization through data and digital health. And I'd like to introduce our speakers. Firstly, I'd like to introduce a good friend of mine, Dr. Marius Nguru. Sorry, Marius, I never get your name right, so you'll have to shoot me later. Marius is the director for the Centre for Health Workforce Research and Policy in Cluj. He's a researcher who has an interest in health and care workforce and health and care workforce policies particularly. He's the president of the health and care workforce section of UFA, and they are very, very, very interested in how digitalization and digital technologies are going to be affecting the workforce going forward, and the things we should remember. My next colleague is Mark Maroli, senior lecturer and research fellow at the University of Melbourne. He's a dual qualified physiotherapist of 18 years clinical experience and a health informatician. He's a consultant and academic in digital health at the University of Melbourne, where he specializes in education and workforce advancement in the field. My third guest is Dr. Sari Palajuki. My apologies, Sari, if I pronounce that wrong. I tend to completely destroy languages as I go along. Sari is a PhD in health informatics and an MSc in healthcare. And she has 20 years experience working in Finland and working in EU with digital health, both at national and regional level. She is also the national prime representative in the EU on EHN, on the WHO HIN, and the chair of the Nordic Council for Ministers on e-health. Marion Logan and Alan Milbourne join us from Scotland, and their role involves overseeing initiatives aimed at enhancing digital leadership capabilities across the Scottish health and care system. It includes leading the implementation of digital strategies and ensuring that the workforce is equipped with the necessary skills to improve service going forward. Scotland have got a very high involvement in this, and I'm pleased to see them join us. So I'm going to give us a quick presentation, quick background as to where we are, and then I'm going to hand the floor to my guests. So going back to the digital strategy of the WHO, the Regional Digital Health Action Plan contains a very, very salient point, and the objective is to promote digital health systems to improve health at scale within the region and to support countries in leveraging and scaling up digital transformation for better health and in aligning the digital technology investments with health system needs, whilst fully respecting, as we all do, the values of equity, solidarity, and human rights. So the background and the context, we have 53 countries within the EU region, nearly 1 billion people, and we have different health and digital situations and trends across the region. We've just come out of, and we are still within a COVID environment, but we've left the COVID pandemic behind, and we're now dual running. And we are surrounded by digital health fever, and it seems to pop into everything we hear and talk about. And there's some real challenges for us to think about. How does this affect the workforce then? Well, there is a strong association between workforce density and health service coverage and health outcomes. What we see using these two charts is the less density we have of health key health workers in any country, the less good the health outcomes might be. Similarly, in under 5 maternal and infant mortality, lower workforce densities tend to point to higher mortality in those areas, and these are well-published sources. The challenges then we're facing in a post-COVID environment, which we need to bear in mind within the context of health worker density, is the supply of health and care workers is challenging, and maintaining services is driving many factors such as burnout and mental health challenges. We have in Europe an aging population, but we have to remember that our population health workforce is aging too. And dependency ratios within countries that exist are changing. In Germany, for example, the workforce density will change from 3.1, that's 3 workers to every dependent member of the population between now and 2100, but double. It'll get worse, 3 to 2. And this is a real challenge for health workforce, particularly in a situation where we're finding it increasingly difficult to recruit healthcare workers, and the population is getting smaller in terms of working populations. This is going to see this is mirrored by a constant shifting burden of disease in long-term care, mental health, NCDs, and the long-term comorbidities, and the increased demand for health services and a smaller pool of workers. We need to rebuild trust in health services post-COVID, and we need to transform patient care. And we need to look at how we do that to involve digitally enabled services. Technology will be a force multiplier, and we can think of the things like digital hospitals and remote primary health care, etc. So there's key significant challenges going forward. And I want to throw the floor to my colleagues, if I might now, and ask a couple of questions. And my first question, I think, to my experts, I'm going to give to Marius first. Given the background that I've just discussed and outlined, and the importance of looking at how we mobilize our existing workforce, what policies or initiatives to address workforce planning and optimization of the existing workforce do you think exist in a Romanian context and in an EU context, given your background with joint actions?
Yes, thank you so much, Chris. First of all, thanks a lot for the invitation, and also for setting the scene and mentioning these introductory remarks, which I believe are crucial for setting the discussion forward. And I have to say that with regards to the conversation that we're having about the health workforce, health and care workforce, and technology. If I were to look at a policy perspective, things are rather fragmented, because one of the things that I have seen in my work as a researcher, but also with my work at the European Public Health Association and the European projects that we're working on, I have to say that I feel there's a disconnect between the evidence that's been accumulating and the extent to which policies have been following that evidence. And we have projects that were part of the European Partnership on Transformation of Health and Care Systems, and an analysis that we conducted just very recently, and we're now in the process of analyzing the data. But we interviewed, as a matter of fact, we surveyed, because we have interviews to be conducted pretty soon. But we surveyed both researchers and policymakers across Europe, and we've seen that there's a great gap between the availability and the quality of evidence and then the policies that are in place. And so some of them are mentioning as potential causes for that the fact that the evidence is not in a format that is familiar to those who are policymakers or those who need to use that. Also, there are no formal collaboration and communication channels between them. So having that in mind, I believe that we are quite at the beginning, in order to make to design policies that are sustainable. And there's a great divide also in Europe with regards to the extent to which health and care systems have leveraged technology with regards to health workforce optimization and planning. If I were to look at my home country in Romania, there is some progress, although as I mentioned, there's a long way to go. And I have to say that maybe the forerunner in this regard is primary care in Romania, where we see significant deployment of digital technologies ever since before you mentioned this digital health fever. I like this term. Ever before we had this digital health fever, but now we're seeing that we're following this in community care. So there's this loan that Romania had from the World Bank, and now they're developing this integrated system where community health workers in Romania can input data and then collect data and then use that for interventions. But I'll stop here because remarks are quite short, and then we can follow up on that. But I'll just to wrap up to say that still we have lots of fragmentation and a great divide between member states with regards to bridging, health workforce optimization and digital technologies. Over to you, Chris.
Thank you, Maris. Yeah, exactly. I think you point to that important, crucial link between evidence and policy and the divide between and how that looks like in terms of the divide when it comes to application. I'm just wondering, Alan, from your perspective, in terms of looking at allied health professionals and the conversation that that's very prescient at the moment and talked to by Marius about the primary healthcare, what you see is the role of digitalization and the use of digital enablement in terms of using more multidisciplinary focus to teamwork and the opportunities there.
I would say, just building on what was said there, I think a lot has been done, to bridge that gap between, what's required from the workforce and the digital and data side of it. There's still a lot of work to do. I could go on at some length about that, but to optimize it, I think this is a culture-led project just as much as it is about the technology. I think if we take it back a few years, the focus was very much on the technology. It was often done at quite a random pace. I think some of the success you could see, at local health boards, for instance, was given, a healthcare worker a mobile phone. That was it, or access to a tablet, that kind of stuff. So it didn't really focus at the scale of what the actual purpose was. And and recently, and especially since the pandemic, we've created that strategy, the digital health and care strategy, that kind of that harnesses that now, and it looks at the cultures. So it's very much about the leadership part. So before you get to that, that part about the workforce out there, being digitized and working digitally, you really have to address that cultural challenge there. You need to make it meaningful. You need to have the right leaders in place. At all stages of the organisation. This comes right from the top, right the way down. So you have leadership instilled all the way through the organisation, so that it outlines the importance of digital, where it can be used, but where it can be used as a blended approach. So it's not always digital first. It's about it's about scrutinising the services, how it can be improved, how the healthcare worker can improve that, and then applying the tools as necessary. But I will always come back to that. It is very much cultural driven here. It's very much about people as much as it is about data and technology. People are right at the heart of this service.
Thanks, Alan. So some good points to bring there. Don't just do it just because we can, and make sure it's appropriate to the environment. But clearly, lead from the front, good strong leadership, good cultural awareness and communications to make sure it's a good solid landing that delivers what it says on the tin, as we say in the UK, so that patients and users of the services aren't disappointed. Mark, from your context, working in the Australian environment and in outside of Europe, have you noticed anything that might contribute to policies initiatives that we can learn from?
Well, look, yeah, thank you very much for having me. I feel very much as a guest and an attendee interested to hear what you're doing over in Europe. Your introduction was very powerful with very interesting to hear some of the challenges that you're no doubt going through. I guess the first comment to make is that they don't exist in a vacuum. They aren't exclusive. Over here in the Southern Hemisphere in Australia, we very much have many of the same challenges. I guess what we lack in density of population and workforce, we make up for in distance. As you know, Australia is a very large continent, very big country, and lots of distance to traverse. So digital health is obviously rampant here in Australia. Again, I'll echo the sentiment of the digital health fever comments. I guess really all just to perhaps answer your question with a bit of context and background. So here in Australia, the digital health scene probably been most accelerated since our national digital health strategy was released in 2017. To fast forward to another 12 months or so, we had our framework for action. So much of what's going on in Australia at the moment is being guided at a national federal level. Our peak body for digital health is the Australian Digital Health Agency, supported by other sort of known entities. Previously the Health Informatics Society of Australia, now the Australasian Institute of Digital Health, whereby, you know, which I'm a fellow of. But we have our major strategic initiatives underpinned by that national digital health strategy, things like our federated national digital health record, which is always in a constant state of improvement and flux, working on other things like secure messaging, interoperability and data quality, other things that we'll probably talk about in this webinar, e-prescribing medication, virtual models of care. Obviously, workforce and education is a big part of this national digital health strategy, our framework for action, so to speak. But from a workforce specific perspective, the sorts of things that I'm drawn to are probably the key themes of what we call our National Digital Health Capability Action Plan. And this is quite a powerful initiative going on, again, at a national level in Australia, which is really underpinning and driving much of the workforce initiatives that are going on. And like Alan sort of touched on before, I'm a passionate allied health professional, so I'm a little bit biased. The third largest health workforce here in Australia. So we're really sort of trying to up the game in getting allied health professionals at a very senior level of digital health. But look, the sorts of things that that I'm sort of drawn to comment on as far as this part of our discussion this morning, this evening for me, are things such as having consistent, you know, we're going to talk about standards. And I feel quite strongly about this, but, you know, consistent guidance and frameworks and standards around what digital health is and what it isn't, which can obviously drive that competency-based and capability-based for the workforce. That obviously then flows on and feeds to education and training, professional development in this area. And this obviously includes providing opportunities for allied health professionals, dedicated senior leadership roles. I recently gave a presentation for at the National Allied Health Conference for your colleagues in Malta, and talked about career advancement opportunities such as, you know, we have chief medical information officers, chief nursing information officers. Well, you know, now in Australia, from a sort of, again, policy level, we're creating dedicated leadership roles in chief allied health information officers. And I guess the last comment I'll make before I hand back over to is, you know, there's a real push, hasn't happened yet, but watch this space. A lot of time and effort going into having our major health professional regulation bodies, even, I guess, academic accrediting bodies that teach our health professionals, having them recognise digital health as a necessary requirement within professional accreditation standards. So obviously we talk a lot more about this, but we'll come back to it.
Thank you, Mark. I mean, clearly there, the themes you're picking up there that, you know, can accelerate progress if you've got a cogent and well-articulated strategy backed up by a good action plan and consistency of standards and a glossary of language that everybody understands, that we're all talking on the same subject. Sari, Finland's a great big country, highly urbanized with lots of rural communities. How do you find the use of technology and initiatives to address planning and optimization of the workforce allow you to do that better in a country with such a diverse population type?
Yes, thank you, Chris, and good afternoon, dear audience, and thank you for having me here. Apologies for having been forced to switch down the camera since the connection is lagging a little bit. But yes, that is a good question. The topic, all in all, is very timely for Finland, and our present government program really aims to solve the shortage of healthcare personnel that is really, or it seems to be threatening the availability of services in a kind of Nordic welfare society. And in this topic, we see that both short-term and long-term measures are needed for solving this issue. And when we look at this issue from Finnish perspective, having really those geographical issues here, there is space for digital services scale up. But before saying that, I think that we focus very much on prevention and self-care of customers, so that we would be able to reduce the need for services, and at the same time service coordination has to be improved. But digital services, for instance, now we are going to accelerate, for instance, the use of long distance spanning solutions. That is among our challenges, but there is much more inside this. All in all, in Finland, we have been quite an advanced country in using, or how would I say, implementing electronic health record systems, and that is possibly among the key tools which we are still having. And in that sense, I have to say that there is lots of opportunities inside really to somehow reduce the clinician's burden and to make the work more attractive, all in all. And simultaneously, you can use those systems really to produce high quality data for primary use and secondary use. And that applies to all of the country, no matter whether it is a sparsely populated area or not. But I think that these opportunities, they apply for urban areas, for rural areas. But maybe I would summarize that long distance spanning solutions, and also having kind of an assessment how the responsibilities of healthcare workers are divided in hospitals and primary care. That might be also a kind of a solution to really have, for instance, in some areas, it might be sufficient to have, for instance, nursing personnel, and to have, for instance, a physician in long distance spanning solution connection, and this type of approaches utilizing digitalization means. But it's really large topic, but I would say that we need to do more in the area of digitalization. And right now, since we are having the good work program at the ministry, so there is also possibility to scale up also those Nordic innovative approaches in the area of long distance spanning solution, just to mention as an example. Thank you.
Thank you, Sari. Very, very prescient indeed, given the context in many countries that remote doesn't necessarily mean isolated, it's often just means hard to reach. And some of the solutions we provide can actually be very useful. You read my mind when you talked about the importance of maximizing or optimizing the use of skills in parallel with supporting healthcare workers with remote support. So being able to allow the patient to take care closer to the patient and allowing them to access high quality services that don't necessarily sit on the doorstep, and that gives an opportunity really to maintain good quality, highly functioning services, but that don't actually require us to have a disproportionate investment in remote services, in terms of having to make sure that we have a high footprint of staff. We can maximize that service using appropriate technologies, but not taking the human out of the context, which I think is an underlying message from all speakers. I want to move us on to thinking about some of the positives, really, and if I can perhaps bring Marion into this as the first answer. So when we're applying the use of technology to support workforce in developing, in delivering healthcare, in optimizing their ability to deliver that care that the patients require, what solutions and enablers do you see as critical to doing that in a context of both for remote settings, but also in highly urbanized areas where services might appear to be more available, but are still challenged by the numbers of workers we can actually mobilize at any one particular time?
Okay, the positives are that people have probably got more ability, capability, confidence than they perhaps realize, although that is challenged by making sure that the leaders within those organizations have got their own confidence and competence in digital ways of working and actually understand what that means for an organization. And that's something that we've been working on a lot in Scotland, because it was an area of concern. I think the understanding where digital can bring a benefit to how a service can be accessed or how a service can be delivered, but that has to be understood within the context that just because you digitize something won't necessarily make it better. So that has to be done within the context of how's it going to work with the system that's already there? How's it going to work with the other, the interoperability of the other systems that are already in place? I think that one of the things that we've been working on in Scotland, which might sound like an obvious thing, but staff working within health and social care really wanted to get the recognition for their digital capability. They wanted to understand where they actually fit within that. What do they actually need to have? What skills, knowledge, behaviours do they need to be able to evidence? So we have developed a capability framework so that people can measure themselves against that. And we have a baseline, which is these are the skills, knowledge, behaviours that are non-negotiable if you're working in health and social care now. Because there is an assumption that certain skills and behaviours are somehow not needed, or they're only needed for particular roles, but actually they're needed by everybody. And important in that regard is that what makes it different when you're working within health and care is you don't need to just have the confidence in your own ability. You have to be confident enough to be able to explain the digital tools or the digital ways in which you can access the service to the people that you're working for, the people who are there to access the service. So it's not just enough for you to have that knowledge in your head or the knowledge how to use the digital tools in your service. You have to be able to explain it to the public, to explain it to people who are using the services and their carers, which is a different level of confidence than I think you would have perhaps within other roles that have a digital requirement. But that recognition is definitely of critical importance. Thank you.
Marion, that's some really good points there. I mean, I'm hearing from you the importance of developing clear, digital competencies and understanding the capabilities that organizations should have in order to be able to deliver services with making the maximized use of those technologies, but also a need really to build digital literacy into the workforce, but their ability to communicate what that means and the benefits and what's happening in terms of the patient, to make that absolutely clear and seamless and less likely to be a mystique to the patient. The other thing you talked about here is understanding the benefits that you're going to realize and making sure that it fits within the way you're doing it. You're not just implementing technology in isolation, you're integrating it into the way you deliver care. I'm just going to come to Mark on that point, and just to talk about what you talk about great progress in Australia in your earlier answer. I just want to think about you to sort of like bring forward a little bit more on some of the solutions and enablers that allowed you to do that.
So look, yeah, that's a great question as well. So thank you. I guess just to sort of add on to Marion's last comment, because one of the things that we have done, and this is perhaps more of a case study from my own region, so from Victoria, state of Victoria, we're down in the sort of southeast corner, bordering with New South Wales, here in Australia. The other piece of that, so digital health capability of the workforce and digital health competency, I was going to say is also organizational maturity checklist. Because obviously if not just the individuals within that large health service, hospital, are able to assess their own digital health level of maturity so that they know where to invest their time or education, you know, the actual organization en masse can identify some of the gaps, you know, where they need to invest time in their people. I know, I think it was probably about 2018, some of the work from the NHS in the UK, developing digital health literacy and digital health maturity checklist, was a fantastic initiative. We developed something similar in Victoria, and this was something, again, to specifically support the allied health workforce, because obviously it's sort of third largest health workforce here in Australia. We developed a national allied digital health capability framework, which included an organizational maturity checklist, which again I think is a fantastic initiative to be able to actually identify exactly which aspects of digital health one might need to spend a little bit more time in. So that's just one particular example.
Thank you. So I mean that clearly talks to the need to think about understanding where the organization in its capability moving forward, and the use of organizational maturity check or digital maturity checklists, observed and objective is very important. One of the things that we found here in Euro in at least one or two implementations is that objectivity sometimes is lacking, and it's not sufficient just to put the checklist out there. You have to have that assessment of whether that checklist is appropriately applied, and I think that's one of the points that you went to. I just want to bring Sari into the conversation if I can. Sari, again, the structure of Finland in terms of the remote and the high density areas is probably not so dissimilar from Australia in terms of that, maybe a little bit colder perhaps. But I know Finland's made great strides in using digital technologies. What were the solution enablers that, if you were to just name but a few, that you could pick to and share with our colleagues, that they might be their best, their best value, their quick wins, if you like?
Yes, thank you. That is a really good question. And of course, there are many aspects, but from pure health or medical informatics perspective, I would say, with my around 20 years experience, that really what makes impact, it is a kind of good standardization, since it is also affecting very much to the phenomenon, what kind of data you will get out of systems. And if we think about today's topic, so really high quality data for secondary use purposes, it enhances also data management and analytics for workforce planning, just to mention. And in that sense, I would say that Finnish success is very much around standardization. But what you need there, since we started many decades ago and have been fully digital since roughly 20 years. I'm talking about electronic health record systems, for instance. So you really need effective data governance frameworks and policies and procedures to maintain, for instance, data quality. And healthcare organizations, they really have to define various aspects of standards for data and have quality control measures, provide training, and promote data stewardship to ensure consistent and reliable data across the whole healthcare system. So I think that overcoming these challenges with this cornerstone in digitalization, standardization, so it requires kind of a multifaceted approach that involves not only technological advancements, but also kind of standardized data models, improved clinical documentation practices, collaboration among healthcare stakeholders. That is perhaps what I would say from health informatics perspective, that every single digitalization initiative should be starting from standardization, since it is a kind of a starting point for patient-centered care. That is what we are talking about, ultimately, patient and customer. And it enhances very much. And that is how we started. And without that, I can say that we haven't been that successful either, for sure. Thank you.
Sari, it's very, very good of you to recognise that, or to come forth and say that it's not always successful. But I think some of the things you pick up from there is that the use of data and the use of technologies, you have to plan. You have to integrate the planning to understand how the application of the technology and how you manage that data, and also understanding the utility of the information and the utility of the data for creating information, and how that becomes really important. And it's not just about bringing in new technology. It's about having essential policy standards, checks and balances, and quality assurance to assure data stewardship. And that means you can utilize that data and that information around the system in ways that perhaps weren't the original intention. Marius, that's an interesting point to come on to, and I know this is something that you've talked about in the past, and it is the sort of ubiquity of information and how that sometimes can be blur the story if it's not properly used. What's your answer to that? What in your experience, what are the solutions and enablers do you see as critical to making sure that we maximize the use of digital health?
Yes, thanks so much, Chris. I'll try to link that with a couple of things that have been mentioned by the other speakers, and also something that you mentioned in the beginning. And I'll start with that, which is trust. And I believe trust is really essential in this. And maybe it sounds, you know, far-fetched to discuss about that. But let me tell you that in my experience working with health professionals, and not only, you know, those who deliver services, but also those who work in public health institutions, I've seen that many times we lose the you know, the potential for data to be used either for service delivery or policy design or for any other purposes in the health system as a whole, because we many times do not follow through to say what we do with the data. How is the data being collected? How is it being used? And then when we have an output, whether it's a report or a policy or a change in the practice, we should always go back to those who worked with the data, provided the data, managed the data, because otherwise, you know, it's you get a sense that your work is not meaningful at all. And we all know that we all do lots of stuff, and I mean, part of the, you know, the intrinsic reward that we get is to know that at least we contributed to something which is meaningful and significant. And so I believe that we also need to take, we as systems, I mean, we need to make sure that we always go back to the health professionals who contributed to the data, and you know, build the trust that what they're doing is really meaningful. And one last thing that I would like to add quickly on that regard, I believe Sari was mentioning about reducing clinicians' burden, but sometimes, and last year we conducted in Romania a barometer for family doctors, and we've seen that many of them complained about the burden that they're doing. But interestingly, part of that burden was linked to how much data they need to provide or input in the digital systems. And so it's not all, things are a lot more nuanced, because it all goes back to what I've said, that all of the people involved in the process across the board are really have the same amount of information and know what is happening with the entire process, and we go back to them to build and maintain the trust in the process.
Marius, that's really, really important. I think that word, it was brought up in the conference in Tallinn in December. Trust is essential, and particularly when we're applying new technologies and new ways of working, and the use of data. And we hear in the press all the time about data leaks, etc., etc. And it's essential that we have good mechanisms for both building trust and actually managing ourselves so that we're able to deliver on that trust. So thank you for raising that. And I also appreciated the point about in each situation, it's nuanced. It's not the same in every setting. And therefore, we need to be adaptive. We need to be intelligent about the way we do things. And we need to reflect that in policies and policy application. Thank you. I think we've got time for one question, which is very, very short, and then I want to throw the floor open to you all to give me your key takeaways from this issue. One of the things that is often quoted in the press, in just general social media, everything, is that digital and AI solutions are going to be the future. And they're often quoted in the context of perhaps a silver bullet. That for me is something that's very, very, I'm very wary of it when people say that. Working in the health system for the time I have, it's not necessarily the case. So what I might ask you is, just in a couple of words, and perhaps starting with Sari, what do you think are the key thoughts on how to use digital AI solutions in safe ways and how we might best use them?
That's a really tough question. Yeah, but how to I would really summarize it in collaboration. Really, how to, I mean, to have a sustainable view. So really collaborate and coordinate the development in multi-professional teams. So from broad perspective, that is perhaps the most important thing, that we combine diverse know-how in the area of digitalization, since it has so many aspects. That is why I answer in that way.
Sorry, that's a good answer, and I think I think labeling on the fact that you have to do this with the people, you have to do it in a joined up and sensible way according to the setting. I'm just going to perhaps focus on Marion to give a context in a Scottish environment, perhaps.
Yeah, I have lots of rants about AI on almost a weekly basis, as Alan knows. I think one of the biggest issues about it is the fear people have around it, and they have to be able to talk about that and what they think that means for their jobs and their interactions with their patients, with their service users, with their colleagues, because that's what's come up again and again when we were conducting our digital maturity surveys. It was thinking, okay, if we digitize things within this service or within this part of the organization, what does it mean for me and my role? Will I get to do the parts of my job that I enjoy the most, or are you going to take that away from me? So I think we have to we have to create the space whereby people can talk, particularly the workforce, can talk about what their fears are around it, and that the leaders within those organizations, it comes back to their confidence and competence, they have to be able to answer those questions and not just dismiss it as, oh, well, you have to embrace change because change is part of our everyday, because that type of response does not go down well. And I think that realistically, whilst AI will assist with does assist with some of the issues around diagnostics, around scheduling, we're still a long way away from AI taking over the primary functions within care and within health and care jobs, that people aspect. You know, not everybody is going to be assigned a robot to take care of them. That's not, well, not in this country anyway. But I think we really need to address what people are scared about.
Yeah. So listening and dealing with people's doubts and fears in sensible manners, and accepting that people aren't always on the fast train there. Marius, your thoughts, my friend?
Chris, I believe that I would link that to something else that was mentioned this in the conversation by my previous speakers, and that has to do also with developing the digital skills, because it also is mentioned in the questions, and I believe that is really crucial as well. And you know that there are initiatives, and if I speak about the Be Well project, where we are also partners, that rings a bell to many of the people, and so I would throw this also in the conversation, because we cannot dream of having people welcome digital technologies, AI tools, without having the skills to discern that and to assess that. And speaking of AI, let me tell you that yesterday I was, as I was mentioning maybe before the call, I was moderating the first plenary session at the European Health Management Association annual conference. And the keynote speech was delivered by ChatGPT. It was my first conference ever where the keynote speech was delivered by ChatGPT. Now, I will not go into details on my assessment of the content of that, but just to say that it is here. We need to integrate it in various aspects. We have to be mindful of that. I guess we all read yesterday the letter from current and former employees of some AI companies. So we have to take it with a pinch of salt, and we need to have discernment, but also being aware of the fact that, yes, this is the future, and somehow we need to navigate it.
Thank you, Marius. Good points there. You know, just because we've got it, we shouldn't ignore the advances because they're advances. We should embrace them when we can, but we should also do it with a an open head and a clear vision as to how both the strengths and the weaknesses that exist and how we can protect against those, or actually protect, maybe too strong, but work within them. Mark, as the final speaker on this question, what are your points of view?
No, look, in relation to what Sari and Marius and Marion all said then, one of the areas that I think we can't ignore here is that, yes, it's exploding. In Australia, for example, one of the areas that's getting a lot of attention is using AI to decrease the documentation burden of clinical notes. This is certainly something that we're taking a lot more notice of, that the health workforce is taking a lot more notice of, whether that be from a fear or actually an excitement perspective, as far as benefits around improving job satisfaction, decreasing burnout, reducing some of the administrative tasks of the job. But these, it's sort of like those floodgates are opening, and more and more vendors and tools are finding their way onto the market. Companies that sort of historically existed in this space are going that way as well. Dragon Dictation. There's all sorts of others, Lyrebird, Heidi AI, Patient Notes. And people are starting to use these, whether that be in the sort of private sector or in sort of the major public health services. But it sort of goes back again, I think, to what Marion was saying, which is we need to have a conversation about it. I was at an AI conference myself yesterday, and we're talking exactly about this, about more and more clinicians starting to engage with AI to support documentation. A whole heap of ethical issues that we won't go into. This could be a webinar in itself around data handling and standards and how these models, large language models, are trained. But we were talking very much about the fact that where is the person behind, at the center of this? We still need to train our workforce and our clinicians to operate with these tools, because we were talking about, I had some master's level health informatics students working with ChatGPT to do some data wrangling and data synthesizing, and the data was just wrong. And the students and myself spent more time teaching the AI language model what we needed from it than it actually helping us get to the answer that we needed. So again, it's just to emphasize Marion's point, which is that we still, and your own, that we still have a long way to go, and a long amount of a long tail, large amount of time where the health professionals are still going to need to be very much working alongside this to moderate, to validate, and so on and so forth.
I mean, thank you, Mark. That's absolutely right. I mean, it's there, it's not going away. People are going to use it. It's going to get better, but we shouldn't just take it on face value. And sometimes it's not necessarily the quickest way. And certainly there's a lot of talk in business, in media, everywhere about the uses of AI and how it's got its appropriate uses and going forward. Before I summarize, or before I close this down, I'm going to invite, we have one question from the audience, which I'd ask perhaps Alan, if you can think about, in the context of digital competencies and the application of those competencies. Are you aware of any research out there that correlates competency with fluency in English, or indeed any particular languages?
Fluency. Sorry, say that question again, Chris.
Digital competency, the expression of digital competency. Is there any correlation that you know with actually fluency in English or any other language?
A competency of fluency in English?
Yes. The question actually is from Maria Yashenko. Is there any correlation on how digital competencies are correlated to English literacy?
I don't understand the question. Sorry.
Don't worry. I think the question is, and if anybody does understand it, Marion.
There is an overlap in terms of competency, but it's more around, when we were doing the work, the research around how to develop our digital and data competency framework, there are numerous competency frameworks that exist that have been published all over the world. And we drew from them because they tended to always highlight the same key capability. We're calling it a capability framework, but the same capability areas. I don't think your fluency in any particular language other than the language you require to do your job is necessary, because it was more around highlighting these are the competencies you need to be able to evidence in order to do your job. And the tools that you use within your role will vary depending on your organization's digital maturity. So some organizations, has been alluded to, are much more digitally mature than others. So you might have to have a higher reliance on an understanding of digital tools and digital ways of working, whereas in other roles, perhaps less so. But it's not so much based on your language, but based on what your actual job is and your level of digital engagement.
Yeah, thank you. So in effect, saying that actually it's almost language independent, so long as the information and the competency is clear, crystal, and the requirements are there, are expressed appropriately. So we literally have 1 minute left. So if I could draw from colleagues to a very quick 10-second statement as closing thoughts, and if I can ask Sari to go first.
Thank you. I would say that define system-specific, for instance, usability and user requirements from kind of clinical or professional perspective. So that is a good starting point.
Thank you.
All in all, to reduce burden.
Thank you very much. Marius, your thoughts, your last takeaway for the audience.
Yes, thanks so much, Chris. So if I'm allowed to play a little bit, so this webinar series is titled Decoding Data in Digital Health. So if I'll play with that, I'll say that we should decode it, of course, initially, but then we should act on that, because when you decode a message, then you don't stop there. You need to act on that message. And so I believe we should act on that and do the job, and then fine tune as we do it.
Thank you. Alan?
Continue to collaborate and share information and resources. And that doesn't just come to finances, that comes down to creative thinking as well. Always collaborate. There's a mountain of stuff out there that we can use, that we can reuse, you know, for development, for information, stuff like that. The barrier really is taken forward and decided on what you're going to use. So it's not always one size fits all, but sometimes it is. So there's a ton of stuff out there, but it all comes down to the collaboration and the right leadership to take that forward.
Thank you. Leadership, collaboration, and one size sometimes does fit multiple feet. Mark?
Look, all I'd like to say on this part, for this part of the discussion, is that capability frameworks and competency frameworks are only good to a certain point. Like Marion said, there are a lot of them that help the workforce understand digital health. But I guess what I want to say is that it's time to bring those capabilities and competencies to the fore, into the light. I think it's actually time that we focus a bit more on what we sort of call entrustable activities. You know, what are the tangible, authentic, real world actions that teach someone in the workforce what it is they actually have to do with digital health that's relevant to their work. Because otherwise, competency statements only go so far.
Relevancy, then, is your takeaway word. Thank you, Mark. And Marion, not least, but last, I'm afraid.
I would go back to a point I made earlier, but say that sometimes this can be scary, to do things that are unknown and things that challenge you. And it's all right to be scared and to just acknowledge that you're scared and to tell people that this is a bit that you're not sure, because you have to get the support of those around you to keep moving forward and changing the ways that you're working.
Thank you. Thank you. Being brave, having courage, building trust, being flexible, being collaborative, being open to difference, I think is the messages we're getting across here. Ryan, I'm going to hand back to you. We've come to just over the end. I've been a very bad moderator, I'm afraid. Over to you, my friend.
Thank you so much, Chris. Your moderation is much appreciated, and I would like to say a huge thank you to yourself and to all the panelists. And this is just a start of this conversation, because as you all alluded to, you know, a lot is going on in digitalization. There's this digital fever, and many of us are in various stages of development of this. So all that you've said has been very, very relevant. And we hope that we can continue this conversation and deep dive into some aspects of it as we move along. I would also like to give a huge thank you to my team who's helping to support me on this. And you know, I couldn't do this without them, and without any of you as speaker and moderator.